I'm going to tell you now a little bit about what kind of skincare I used and body products around the time of my face and neck lift. I've gotten several questions about that, so stay tuned. Hi, for you guys that don't know me, my name is Dr. Jennifer Walden, and I am post-op day 5 right now from a face and neck lift as well as an eyelid lift here in New York City by the famed Dr. Sherrell Aston. So here I am post-op day 5, and I've gotten a lot of questions about what do I have as far as skincare, body care that I used and had on the nightstand. So I was going to show you a little bit of that. So we're just going to zoom in. And don't get overwhelmed, but what I first started with using was ASC Exo Mist, which was an exosome mist, and I would spray that on my face every day, even the day of surgery, even though they didn't know that. I also have been using the Exo Pro cream, which is a bio-stimulating cream for help and regeneration of the skin cells and just really replenishing that external skin layer. Of course, any surgery wouldn't be complete without arnica gel. Arnica can help with pain relief, muscle pain and stiffness, and bruising. So as you can see, I don't have a ton of bruising. I've used a little bit of concealer today, and I'll show you that here in a minute. But we'll go on to the next thing, and that is, I love this little cream that I got at CVS because it has watermelon, squalane, ceramides, and strawberry. And what I wanted out of that was the ceramides, and I wanted the squalane just to help rehydrate my skin and add back some integrity with the ceramides. So next, then, we have Prequel. I love this brand. I got this at Target, and this I brought mainly just to hydrate the skin. Instead of just putting plain tap water out of the New York City tap, I would use this, and it would really help. It has osmolytes in it and glycerin, and so it was a little bit thicker than water. Great hydration. Used that very early on rather than dunking my face in water, which we couldn't do. Easy way to clean any surgical site is hypochlorous acid solution. So I used Magic Molecule, which is an antimicrobial skin spray. This is just every day. I use it even without surgery, but I use it on the incisions, and it can clean those off. We use this in my office often for people who've had tummy tucks or breast reductions to clean the incisions. So any type of hypochlorous acid is a must-have as far as skin spray. This I got in London. So this is Miso Wharton P199, and it's a post-treatment mask. And because I got a chemical peel around the eyes, I basically have some peeling skin, which you can't really see right this moment in time because I have a little concealer on. But what I did was I put this on the first few days after surgery just as a mask. And it has Wharton's jelly in it. And if you know anything about some of the bioregenerative products that are topical, that really helps to stimulate some of the stem cells and epithelial cells as well. Paula's Choice. I've got to hydrate my lips or I feel like something's totally missing. I feel like a car without gas in it. So Paula's Choice has peptides in it. It's a great lip treatment. I got this in Korea, but it's an American brand, I believe. And then a mask that I'm using at night now is called Do Not Disturb. This is a Korean rice sleeping mask, and it doesn't have a bunch of additives and anything like that. It's very organic, and so it has vitamin B5, which is great for skin, and hyaluronic acid, which is just one of the best things for skin there is because skin is made of hyaluronic acid, and it has a little glow in the dark to it as well. So that's my sleeping mask. You saw me the other day on the first or second postoperative day doing my CO2 Lift Pro, and that's a carboxy gel. And what it does is it releases oxygen to the tissues. And so that was very important. And I think I did a post on that. So CO2 Lift Pro, put on any skin flap after surgery. We use that in plastic surgery all the time. I'm going to turn over here and just show you some other recovery items that I use. I've been using a mask to help with swelling. So these masks we use with our generic procedures. $6 on Amazon. I can send you the link if you need it. CeraVe, this was great to wash my hair and body with because it's baby shampoo, so it's very, very gentle, and I could actually wash the incisions with that. HipaCleanse, this is basically antimicrobial. I showered with it a couple of the days and the night before surgery, and then I showered with it the morning of surgery. Here are my little ice packs that I got that are so sweet, and we use them in my office as well. These I use for my inner thighs that got a little bit bruised, kind of, because I got some fat taken from there on both sides. Thank goodness. Thank you, Dr. Aston, for that. So I have skinnier thighs, but that's where the fat was taken. So I can use these things for that. My private duty nurse made this wonderful thing, and I have about 20 of these in the freezer. And so what we do is we lay these on the face and the eyes, and they help conform and help with swelling. If I put concealer on for a picture, I would just take it off right away with Aveeno Calm Restore. These are really easy to travel with. And then I love this deodorant. My favorite deodorant in the world is Parisian. It's Vichy. I love this brand, and I got this here at CVS, but I usually get it when I go to Paris. I'll grab a whole bunch of this type of product. Skin food, I got this here at CVS, and this is just a really rich cream for your skin, and I've been using it on my body because I did have fat taken from 2 donor sites, and the skin is just very, very dry. I've been on GLP-1s a while. It kind of dries and thins the skin. For my hair, it was really, really stuck down from the betadine and the prep and all the surgery that went on. So this is the conditioner I use, as well as the all-in-one milk that I spray to help get the tangles out. So that's it. Oh yeah, here's my bunny thing for the mask. And that's a cute thing. I'll show that later. So that's it for my body care and my skin care. We'll go to the makeup next. Hi, I'm Dr. Jennifer Walden, and I wanted to show you what I've been using here in New York City. I am at day 5. I had a major plastic surgery on Monday, and it's Friday. So I had a high SMAS facelift by Dr. Sherrell Aston in New York City, and he is on 728 Park Avenue. I've been asked a lot about what type of skincare have I been using and or cover up to help with bruising, because I bruised a lot. Apparently I bled during surgery. I've had a lot of energy-based treatments, radio frequency, ultrasound, you name it over the years, I've had it. So Dr. Aston took his time and had precise dissection, so he's really to credit here, but I'm going to show you some things that have helped me along the way. Give me a second and we'll show you. Okay, so here we are with what kind of cover-up do you use after surgery from a plastic surgeon who just had a major face and necklace surgery. One, I just remember to put this on the incisions. This is mupirocin or Bactroban ointment, and it's by prescription, but it helps, especially healthcare workers that get surgery who may have been exposed to MRSA in the past. And I used it in my nostrils a couple of days before surgery. My nurses would be very proud of me for doing that. But this goes on my incisions because I don't want to put makeup on my incisions or stitches. My favorite thing in the world is Charlotte Tilbury Airbrush Flawless Blur Concealer. And I got that in London, I believe, but obviously you can get it anywhere. This is in medium color. With that goes Wonder Glow. So this is my second favorite thing in the world. It's Instant Soft Focus Beauty Glow Primer, but it gives a tint. And I don't love foundation. It makes my skin look older, it crackles, and these things don't do that. They kind of hydrate the skin as they go along. The Charlotte Tilbury eyeshadow. I don't really put this on my incisions, but I did use a little bit when I filmed yesterday in Dr. Aston's office, and I love Charlotte Tilbury. Another great find that I found in South Korea when we went to Seoul is the Amuse products. These are amazing products here. Let me open this for you. That have SPF 38 in them, but they're concealers, and I love white. If anybody knows me, they know I love any kind of white makeup, whether it's a base or a primer or foundation, whatever. So Amuse is great, and look at this. Amuse has this wonderful dewy glow, and it's SPF, but also is makeup. And so this again is more kind of like that Charlotte Tilbury product. It has SPF 38 in it, so that can be a cover-up, but it's also great makeup. And I found these in Seoul, South Korea when I went and visited for a meeting. Fenty Beauty, this is a must. I have these in a couple of colors, but this is walnut. So this I just use on my cheeks just to give a little bit of highlight. So Fenty Beauty. Solowasu is a Korean brand. I think you can see the trend here. This color that I got for my lips is kind of a natural lip color of mine that I have a little bit of permanent tattoo on from Erica Miles, but the color name here is called Tara, who's actually one of my favorite people and an esthetician of mine. Okay, here's Christian Dior. I use this anytime I put makeup on. Like I said, I don't love foundation. This is in color medium, but it's Dior's loose powder, and I've been using that for probably 15, 20 years. Kosas, you can buy these on Amazon, but they're really, really good kind of final powder sets for your makeup once you put it on. So obviously if you've had surgery, this is a must to put over the concealer just so it doesn't look sticky. So this is Comfy Cloud Set, and there's all sorts of different shades that you can get. Now, if I was going to the Broadway show with my sons tonight, which I'm not, I would use a little highlighter, which I could use on my cheeks. And I love the Giorgio Armani. This is Luminous Silk Aqua Highlighter, and it's so beautiful. And it doesn't come out white. It comes out very transparent. So that's what I would use if I was going to go to the show tonight. But I'm going to rest my face and get into my face mask. So thank you for listening to me. Ciao.